So hey guys, welcome back to my channel. In the previous video we discussed about the introduction part of the anatomy, and today we are going to start with the next chapter, which is all about bones. So it is mostly important for your practicals. Like the examiner will ask you to identify the bone, will ask the attachments of the muscle, either origin or insertion, or ligaments or grooves or any landmarks of the bone. So you need to get the knowledge of each and every aspect of the bone. You need to identify the side determination of bone is also important, like of what side the bone you are having in your hand. You need to identify by palpating your visual observational skills and everything. So let's begin with it. First, introduction. Out of 206 total bones in men, the upper limb contains as many as 64 bones. Each side consists of 32 bones, the distribution of which is shown in table 1.2 and figure 1.1, which we discussed in introduction part. Since bones of the two upper limbs are similar, one needs to learn only 32 bones out of the total 64 bones. Like we have same bones on both the sides of the body, like on the left side and on the right side. So we need to just master only one part because it's all symmetrical. Like on one side we have clavicle, the other side will be having clavicle, but it's different for the abdomen, as we have single trunk, single abdomen. So yeah, let's see. This applies to soft part as well, like muscles or anything. One learns only one upper limb, the other upper limb gets learned on its own. This is true for the whole body except parts of the abdomen. Actually, one needs to master only 50% of the body and the other 50% get mastered by itself. The individual bones of the upper limb will be described one by one. Their features and attachments should be read with the bones before undertaking the dissection of the part concerned. The paragraphs on attachment should be revised when the dissection of particular region has been completed. So introduction is telling about how you are going to study. You need to revise everything during, before and after the dissection part. So you need to connect theory and practical both. Now let's start with the clavicle bone. Clavicle is also known as beauty bone. The clavicle, in Latin it is called a small key, is a long bone. It supports the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmits the weight of the limb to the sternum. The bone has a curved part called the shaft. Shaft is also called body, and two ends, lateral and medial. So in this paragraph it is told that it has two parts, two which are medial and lateral ends. Medial is towards the body on the middle aspect, and lateral end away from the body, and shaft. Clavicle transmits all the weight of the upper limb fingers, shoulder, forearm to the trunk part. It is told here. Now, how we will determine the side of the bone? Like the bone which you are having in your hand during examination, of what side, like right or left side bone you are having, you need to determine it by observation and palpation skills and through knowledge of the anatomy. So next, the side to which a clavicle belongs can be determined from the following. The characteristics here are described. The lateral end is flat. The flat end is lateral one, which is away from the body, and the medial end is large and quadrilateral. Remember this. You need to hold the clavicle in such way that the outermost part is flat and the one part which is broad, quadrilateral, large should be towards the body. Like this is broad part, okay, and here it's going flat, that's lateral. The shaft is slightly curved so that it is convex. Convex means this part is convex, this part is concave, this part is concave. Cave means something, a place which is inside, dark, cave where the ancestor used to stay. Remember that way. This is concave. So the shaft is slightly curved so that it is convex forwards in its medial two-third and concave forwards in the lateral one-third. The inferior surface is grooved longitudinally in its middle one-third. The inferior, now we will discuss about how many borders, surface a bone is having, which is clavicle. Now, peculiarities of the clavicle. Characteristics, if we are asked what's the speciality of the clavicle, so it is only long bone that lies horizontally. There are other long bones too, but they don't lie horizontally. They are either vertical or any another plane. It is subcutaneous throughout. We can palpate. It is the first bone to ossify. It is the only long bone which ossifies in membrane. It is the only long bone which has two primary centers of ossification. See, here are, you need to remember like mnemonics or something. You need to arrange in your mind. 3 points are about ossification. Now 2 points are of how its morphology, like we can say it morphology, it's horizontal and subcutaneous. Now there is no medullary cavity. It is occasionally pierced by middle supraclavicular nerve. Two different points. You need to categorize in your mind so anatomy will be all easy for you. Now next, it receives weight of the upper limb via lateral one-third through the coracoclavicular ligament and transmits weight of upper limb to the axial skeleton via medial two-thirds. The ligament for weight transfer, coracoclavicular ligament. Now, what are the features? Shaft. Shaft was body. Shaft is divisible into lateral one-third and medial two-third. The lateral 1/3 of the shaft is flattened from above downwards. Lateral is flat and lateral is 1/3. Lateral 1/3 flat. You need to remember just one thing and the opposite will be remembered by its own. It has two borders, anterior and posterior. The anterior border is concave forwards and the posterior border is convex backwards. This part of bones has two surfaces, which is superior and inferior. The superior surface is subcutaneous. The inferior presents as an elevation called the conoid. You need to remember the word conoid. Conoid means cone. In Greek it's cone. Conoid tubercle and the ridge called trapezoid ridge. Where is it present? Inferior surface. Superior surface is subcutaneous. As we palpate, we don't find any grooves or any landmarks by our palpation skills. By touching, we can't feel it. But in the inferior surface, two main landmarks are present, which is conoid tubercle and a ridge. Ridge is some depression like, and tubercle is a pointed projection coming out from the bone. Now the medial 2/3 of the shaft is rounded, quadrilateral and said to have four surfaces. Four surfaces quadri. We discussed here. Quadrilateral. 4 is quadri. The anterior surface is convex forwards. Now connect lateral 1/3 and medial 2/3. Okay. The anterior surface here was concave, but the anterior surface here is convex. So it's going to be like something like snail. One is concave, opposite. It's going to something like this. The posterior surface is smooth. The superior surface is rough in its medial part. The inferior surface again has oval impression on the medial end. The lateral half of the surface has a longitudinal subclavian groove. Groove is little bit of depression in the bone. The nutrient foramen lies at the lateral end of the groove. Now the figure we are gonna see. Here is the direction how the bone is held. Like this is the anterior part. This is the anterior part. This is the lateral part because it is flat. No, sorry. This is sternal part. This is quadrilateral. We can see it. This is flat. This is lateral. On the lateral end, it is acromion end because it is going to form acromioclavicular joint. And on the medial end, it is going to form sternoclavicular joint. So lateral 1/3 and medial 2/3. Again, the direction is changed so that all the landmarks are present on the inferior surface. We need to remember that. This is impression for costoclavicular ligament, which was important for weight transfer. This is subclavian groove. Sub is inferior. Below clavicle means inferior aspect of the clavicle. Subclavian groove, it's almost in the middle aspect. And trapezoid ridge on the lateral aspect and conoid tubercle, pointed tubercle little bit. Ridge is longer, but this mountain like formation is called tubercle. Just remember the words, you need to go through once again. So you need to connect each and everything. Now lateral and medial ends. What's that? The lateral or acromion end is flattened from above downwards. It bears a facet that articulates with the acromion process of the scapula to form acromioclavicular joint. The medial end or sternal end is quadrangular and articulates with the clavicular notch of the manubrium sterni to form sternoclavicular joint. The articular surface extends to the inferior aspect of the articulation with the first costal cartilage. So this is all I explained just now in the figure 2.1a and b. So this is how you're gonna hold the clavicle. You need to hold the medial part on the medial aspect, the lateral part on the lateral aspect should come, and on the same you need to hold the bone on the same hand of which the bone is. Like if it's the right side of the bone, like right side of the clavicle, you need to hold the bone on the right hand. Your holding position will describe each and everything to the examiner, in spite you don't speak anything, okay? Examiner is going to observe you from starting to end, your confidence, your knowledge, each and everything. So you need to handle the bone in such way. Now what are the attachments of the clavicle? At the lateral end, the margin of articular surface of it for its acromioclavicular joint gives attachment to the joint capsule. Joint capsule is a thick sheet of covering which covers the joint, in which if it's synovial joint, the synovial fluid flows, which gives you the nutrition and each and everything to the joint. At the medial end, the margin of the articular surface for the sternum gives attachment to the fibrous capsule of the sternoclavicular joint all around the joint. So by this we can get to know the medial end, which is sternoclavicular joint, is fibrous type of joint. The articular disc posterior superiorly, the interclavicular ligament superiorly. Interclavicular ligament connects both the medial ends of the clavicle, which lies just above the sternum. A small sheet of ligament passes just above the sternum so that it connects the medial end of the clavicle, which holds both the clavicle medially. So now this in this figure, what's the difference between all the colors? Why this is red, why this is blue, why this is green? We need to get through it. So the blue part tells you about the insertion of the muscle. Blue part is insertion, and red part is where the origin of the muscle is there. Green part gives the ligament attachment. So there is no origin or insertion in the ligament. Ligament is present between two bones. We can remember it in a similar way, which is bubbly, bone to bone ligament. And muscle is originating from the tendon and gives insertion at the bone. Okay, so only muscles have origin and insertion. No ligament have no ligament have origin insertion. It only have attachments. But muscles do have attachments, which is origin and insertion. Okay, like we can't describe from where the ligament is going, from where it's going to end. We can tell, okay, from here the muscle has started and at this point the muscle is going to end. we can know the origin from where the muscle has grown, but for ligament we can't tell, because ligament is just for mainly stability, but muscles do have muscle fibers and all, so it works for the action, and the muscle action depends upon the direction of the pull of the muscle, that we are going to discuss in upcoming lectures. So yes, now let's read and then connect it. Here we have discussed about the ligaments, and now again lateral 1/3 of shaft. What's present on the lateral 1/3 of shaft? This is the lateral part, okay? This is lateral part, and this is all medial part. Now on the lateral part we have capsule of acromioclavicular joint. On the inferior aspect of the clavicle we have deltoid origin, inferior or posterior aspect we have deltoid. Then on inferior aspect we have trapezoid conoid parts of coracoclavicular ligament, and over the anterior aspect we have insertion of the trapezius muscle. In the middle part of the clavicle we have subclavius muscles insertion, inferior surface of the which was subclavian groove. In subclavian groove we have insertion of subclavius muscle. In the anterior, now let's connect, okay? The anterior border gives origin to the deltoid muscle. Here we discussed. The posterior border provides insertion to the trapezius muscle. Again, this is posterior part. The conoid, tubercle and trapezoid ridge gives attachment to the conoid and trapezoid part of the coracoclavicular ligament. What part? The name of the ridge and tubercles. We need to connect all the theory. Medial 2/3 of the shaft have most of the anterior surface going to give origin to pectoralis major muscle. Half of the rough superior surface gives origin to the clavicular head of sternocleidomastoid muscle. Clavicular head. There are another head of the clavicular, other than clavicular head of sternocleidomastoid muscle, which we are going to see in upcoming lectures. The oval expression on the inferior surface of the medial end gives attachment to the costoclavicular ligament. Costo is ribs and clavicle. So inferior surface, of course, first we have ribs, then above that we have clavicle, okay? This is clavicle. So if we are going to connect this both, this is downwards, this is upwards, we need to connect both. Then how we are going to connect? The inferior surface should be attached with the superior surface of the rib, inferior surface of the clavicle and superior surface of the rib. There is where going to be costoclavicular ligament. The subclavian groove gives insertion to the subclavius muscle, like the name suggests. The margins of the groove give attachment to the clavipectoral fascia. Like this is going to be covered with clavipectoral fascia. The posterior surface close to the medial end gives origin to the sternohyoid muscle. It is a small muscle. The subclavian vessels and division of the trunk of brachial plexus pass towards the axilla lying between the inferior surface of the clavicle and upper surface of the first rib. Subclavius muscle acts as a cushion for all these vessels and brachial plexus. The nutrient foramen transmits a branch of suprascapular artery. So just mainly remember this diagram, palpate and connect all the dots. Even if you don't remember the theory part for bone, you need to learn this diagram. It's the stars are less, however more I give this. So just remember the diagram and go through it. Remember the lateral medial part, but we are going to discuss the each and every muscle in detail, the movements, the origin, the insertion, the nerve supply, each and every part. So it's all going to be so easy for you. We need to connect everything. Sorry if you feel like I am repeating the same sentence. We need to connect, but it's the reality for anatomy. The clavicle is the first bone to ossify we saw in the characteristics. Except for its medial end, it ossifies in the membrane. There are two primary and one secondary center. This all we saw. The two primary centers appear in the shaft between 5th and 6th decade of intrauterine life and fuse about the 45th day. The secondary center for the medial end appears during 15 to 17 years and fuses with the shaft during 21 to 22 years. Occasionally there may be secondary center for the acromion end. Two primary centers, one secondary center. Just remember all this. The characteristics are described in detail in the shaft and ossification and all that parts, and you need to remember that characteristics or peculiarities of the clavicle, which can be asked you during your Viva or 5 marks question. So what's the clinical anatomy? What's the application of the clavicle that we saw in the medical aspect? The clavicle is commonly fractured by falling on the outstretched hand, that is indirect violence. The most common site of the fracture of this junction between the two curvatures of the bone, that is lateral 1/3 and medial 2/3, which is the weakest point. The transition point is the weakest point. The lateral fragment is displaced outwards by the weight of the limb, as the trapezius muscle alone is unable to support the weight of the upper limb. See, the lateral part goes downwards. This is going to go upwards because of the pull of sternocleidomastoid. But here is deltoid, weight of the arm, which is not going to be beared by trapezius. Trapezius is strong muscle, but not that strong, so it can lift whole upper limb. The clavicles may be congenitally absent or imperfectly developed in disease called cleidocranial dysostosis. Absent clavicle or imperfectly developed. In this condition, the shoulder droops and can be approximated anteriorly in the front. As the clavicle is absent, the shoulders droop inside from the anterior as the clavicle is not there. The bone is not there. Who is going to hold them in position? The muscles will pull the chest inside, and the person may result into more of a kyphosis like of clinical presentation. So yeah, that's all for today, and do revise the clavicle bone, and if any query or question related to same, you need to comment in the comment section, and do like, share and subscribe to my channel for the upcoming videos. Thank you.